So our next speaker is Dr. Kalana Guruge from Sri Lanka. He's going to talk on bilateral simultaneous PCNL, 7-year Sri Lankan experience of a novel approach. Over to you, sir.
Good morning, ladies and gentlemen. Greetings from Sri Lanka. I would like to express my gratitude to SARC Association of Urological Surgeons to give this opportunity to share some thoughts on bilateral synchronous PCNL. There's a significant rise in the global incidence of factors that are related to increased risk of developing kidney stones, metabolic syndrome, hypertension, diabetes mellitus, obesity, gout, and chronic renal disease, to name a few. Nephrolithiasis or kidney stones is one of the major growing health problems in South Asia. Management of bilateral renal stones have always been a challenge. Conventionally, they have been treated with staged procedures. But recently, there have been an uprise of synchronous bilateral PCNL among the literature. Due to the technically demanding nature of this surgery and the fact that the little number of studies have been done in this area, the suitability and the practicality of its use is a mystery. There are significant advantages of bilateral synchronous PCNL. Renal stones in both sides are removed in a single session that will reduce the overall hospital stay, recovery time, anesthesia time, and total radiation exposure. And some studies have shown there's increased stone-free rates, 94% to 82%. Having said that, there are several disadvantages as well. Due to its technically challenging nature, a high level of expertise and experience is required. And this procedure is performed under general anesthesia and preferably in the prone position. And it may not be suitable for all patients with bilateral stones due to the lengthy operative time and patient factors. To share some thoughts, how I do this procedure. The customary bilateral synchronous PCNL is doing mostly doing the mostly clinically significant side first. And this may be more complex and time consuming. This side was initially draped. After dealing with the primary side, the image intensifier will be repositioned, and following that, the contralateral side will be draped and attempted. Contrary to the present literature, our surgical technique differed as follows. Both sides were cleaned and draped simultaneously, and punctures to both sides were made in inception. Less time-consuming side will be dealt first. Neither the operating table nor the image intensifier will be changed from its original position. The digital monitor was kept at the head end, and the image intensifier monitor will be kept at the foot end throughout. So I'll share my results because our study has been selected as a paper presentation. So at that time, I'll give these results. So we had 51 patients during the years of 7 years. So during the process, we had so this is a comparison of our study with the currently published several studies across the globe. This shows a comparison, and the majority of these studies were done in India, and I can see two authors in the audience, and they were conducted over extended length of time to have an adequate sample size. Compared to these studies, the stone-free rates and the surgical times were comparable of our study. Conclusion, this study was demonstrated our novel method has a safe and efficacious, and this technique clearly reduced total anesthesia time, and nevertheless, this has paved way to more convincing evidence to brought forth. Thank you.